Hey listeners, after the pod, don't forget to claim your free 2-week trial on the Better Yoga online studio. You'll get unlimited yoga and breathwork classes guided by expert instructors. We're a small women-owned business, and you signing up for the free trial really makes a difference. Now here's the show.
Hello and welcome, everyone. Welcome back to the Better Yoga Podcast. I'm your host, Kari Harendorf, and today on the pod, I am deeply honored to welcome Dr. Ismita Itkarkar, Ayurvedic physician, master diagnostician, and beloved teacher. Dr. Ismita, founder and director of Vedify Ayurveda, and has been practicing this form of medicine in its pure classical form for over 24 years. She currently runs 3 Ayurvedic clinics and a fully equipped Panchakarma healing center in Pune, India, where she works extensively with complex and chronic conditions. She specializes in women's health, issues like infertility, menstrual disorders, skin and hair therapies, lifestyle disorders, and joint issues, bringing both precision and compassion to every single patient she treats. She also serves on faculty at the Minnesota Institute of Ayurveda, where I had the privilege of studying with her. She was one of my teachers, and her clarity, rigor, and depth left a lasting impression on me. She would talk about case studies from her early days in Ayurveda, remember every single patient, their families, their histories, and would be able to figure out root causes where any Western doctor, and including her own professors, would be stumped. What makes her truly extraordinary is this skill as the diagnostician. She asks deep, thoughtful questions and takes in the full picture of the person sitting in front of them, not just their symptoms, but their rhythms, their patterns, their constitution, and their whole story. She listens for the root cause, which is the root of Ayurvedic medicine. In today's conversation, we're focusing on PCOD and PCOS through the lens of Ayurveda, its causes, doshic patterns, tissue involvement, and how true healing requires this holistic approach. I am so looking forward to this rich and illuminating and hope-filled discussion. Thank you so much, Dr. Asmita. It's so nice to see you and get to talk to you.
I'm honored by the way you introduced me. It was so heartful and it really touched my soul. Thank you for inviting me. And yes, as you said, PCOS and PCOD, these are like very complex, multifunctional, multi-system disorders. So let's dive deep into it.
Okay. So just to give our listeners, in case this is not a syndrome that touches you or someone you love, a little overview through the Western medical lens. So PCOS, Polycystic Ovarian Syndrome, is considered an endocrine, but also a metabolic disorder that affects women mainly of reproductive age. So in the Western medical model, it's understood as hormonal and metabolic. And the characteristics are often irregular or absent ovulation, insulin resistant, cystic ovaries, acne, weight gain, and fertility issues. So treatment in that allopathic medicine usually involves symptom management. So regulating cycles with birth control or addressing insulin resistant or supporting ovulation when, conception is the goal. But while these interventions can be helpful with symptom management, many women, and I did a talk on this in Kripalu's Ayurvedic Yoga Therapy Women's Health Day or training, that their symptoms are feeling like they're being managed rather than understood.
Exactly.
And especially when it's considered a syndrome, and I want to ask you about that, a syndrome or a disorder is that the women present with different symptoms. And so often it's not diagnosed or misdiagnosed or underdiagnosed for years. So it presents differently in each person, often reflecting like a deeper imbalance or systemic imbalance rather than one single isolated issue. But this is why I believe Ayurveda can be so helpful in this, because Ayurveda is a form of medicine where every individual is seen as individual and is treated as individual, not like one pill or one protocol for a dis-ease, right? So rather than viewing PCOS as a uniform diagnosis, Ayurveda understands the pattern of the doshic imbalance, right? What tissues or dhatus are being affected. And I'm really excited to talk to you about more the subtle layers of that, right? The way that the pranamaya kosha, or the energetic body, that flow of energy in the body, particularly within the shukra dhatu or the artava dhatu, right? That the reproductive tissue.
So impressed.
And the health of digestion, or the agni, the presence of ama or toxins, and the role of lifestyle, stress, and nervous system regulation. So we have about an hour to deal with all of that.
Wow. And yes, before we start, before even you ask me something, I want to share you one analogy. So when we look at any plant or tree, right? So it bears fruits or flowers, right? So if you just look at PCOD, just as you said that I try to look at it in the whole. So doing the same thing here again, just try to look at a woman and her ovum as the fruit that she is giving. So if you look at that way, so then for her to bear that fruit, she should get a proper nourishment, a stable ground, support, air, everything like the Panchamahabhutas, and a good amount of water, sunlight, everything. And then that plant will bear particularly a very potential and viable and very nice fruits, like healthy fruits. So similarly, if you think of a woman, like she's bearing that fruit. So every ovum that she delivers, see, when we are in the intrauterine life, we have around 3 lakhs of these possible ovarian follicles. So when a female child comes to birth, kind half of it is automatically they diminish or they get destroyed, and we are remained with around 1 to 1.5 lakhs of follicles, ovarian follicles. Until the age of puberty, 300 to 400 ovarian follicles remain as a possibility of childbearing. And every periods, every menstrual cycle, we deliver that one fruit. So in PCOD, exactly that is not happening, that the fruit or the ovum or the follicles do not reach maturity. So there is some disturbance. Now from here,
Right.
from this perspective, when you look at it.
Yeah, I love that. I love that analogy, because we are beings of nature. And when you think about the
Correct.
layers of dhatus or tissues, the reproductive one is like the last one. Like a plant is not going to put its energy into bearing fruit if the soil is bad, or it doesn't have good
Correct.
air, or it's not getting the right sunlight, right? So that's
Correct.
a very
Thank you.
So based on like what I just talked about, the introduction, how does Ayurveda differ from the conventional biomedical model in how it views PCOS?
So, having said the thing about the tree and the fruit thing, so instead of going and diving deep and just giving whatever is required, so like if there is insulin resistance, we are giving something like a metformin tablet. If there is some FSH level or some other hormonal imbalance, we give hormonal tablets, clomiphene, and so many other things. So instead of just doing quick solution, this answer might be disheartening, but it's the real answer that you have to bring back a normalcy to your life. So Ayurveda looks at the entire picture. It will look at the ama, it will look at the digestion, right? Starting right. So I'll check one point at a time. So some women do come with a direct complaint of recent development of irregular cycles. So what she's saying is very important to me. So how it manifests,
Okay,
I want to
so
find out the story behind it.
yeah, so when they come with this presentation, or before you're going to give a diagnosis of that, and I know Ayurveda has a whole other view of diagnosis, but like, what are you listening for first? Even if we're going to use that plant analogy, right? Like, you're listening for the lifestyle causes, you're listening for this presentation of,
I'll tell you.
okay, this is
I'll tell you.
clearly an endocrine problem, this is clearly a digestive problem. And so when you have like all of those differentials,
I try to build a story around it. As used to tell you during our classes, that it's like a
Yes.
detective that we are trying to find out when it was normal and when it went bad. Or is it abnormal since the beginning? So I'm listening whether during her puberty, if it was a regular period, normal menstrual cycle for her. And usually, Kari, when these girls, young girls, they stay out of the home for, say, college, graduation and such things, the nourishment generally depletes. Usually they snack a lot, they have sugary food, heavy burgers and fries, and all those things come into their life suddenly. And there the seeds of PCOD are sown. And then they might, after some like 4 months, 5 months of this binging, like munching and binge eating and all those things and sedentary lifestyle, then they start missing periods. And it's like a cycle. Plus, one more thing, like I am not sure if it is mentioned anywhere at all, but this is my personal outlook towards PCOD, that now the feminine energy that we carry is not that well nurtured. Like maybe in the beginning, if you see old classic movies, you will see a delicate lady and she's carrying herself in a certain way. And now you look at women, we are kind of mimicking male patterns, male dressing, male appearance, male dominance, male talking. So I personally believe that all this has aggravated into a high androgen level. So it's good. In earlier days also, women were strong, but women are strong mentally and physically they're delicate usually. But then they have attributes like kindness, compassion, calmness, stableness. And now everything has changed into stress, anxiety, overwork,
Yes.
isn't it? So a lot of, and in this equality thing, what we have done is we are doing our old course also, plus we are taking up very huge responsibilities in our offices, in our workspaces. Plus, we are trying to do so many things at a time, multitasking. That is our core thing. But then it's taking a toll on ourselves. And then I feel that somewhere the testosterone is secreting more. And you can see that even the facial structure of PCOD, like when I see cases of PCOD, young girls or not women, but young girls especially, the structure is different. They carry themselves in a different way. I can say, of course, signs of hirsutism are there, so unwanted hair. So a lot of aggression. Either aggression pattern is there, or then excessive overthinking, stress, worry, anxiety. This pattern is there. So now we worry for
Right.
everything. If you're married, you worry. If you have kids, you worry. If you don't have kids, you worry. If you have a job, you worry. If you don't have a job, you worry. So worry is
Yeah,
constant.
the one constant is stress across the board, right? And that's
A thyroid gland, a pituitary gland, and all the, like, the feminine part, feminine energy is more disturbed with this stress. That is my observation.
when you just said that, that was a realization for me. And not don't all the feminists, like, don't give me the bad comments here about where's the just as strong. We are just as strong, but it is so true. And it reminded me, I had a couple of thoughts while you were speaking. First of all, I grew up in the 70s, so it was very much more traditional, where the women stayed at home and the men worked, the women raised the family and was like the homemaker. But a lot of women, they got the right. They fought so hard to be able to go out in the workforce. They got that. And I'm thinking about, like, my best friend's mother who went out to work, and it was just like, oh my God, she still had to do all the grocery shopping on the way home, come home, cook the dinner, clean up the dinner, do everything. I was like, what did we win? We won 8 hours more a day of work and stress outside the home to have the same responsibilities once we came home. And
Correct.
so to have to carry that, right? And also, even in thinking back to when I learned about rose and the qualities of rose and how it speaks and soothes the woman's soul, right? Like, every woman should wear rose, and it's cooling and pitta pacifying and all this, but that it really worked down again on that pranic level. And I was like, that's so interesting that this is something. And when you'd said, like, we're trying to emulate men and strength. And if you look on social media, it's all these women lifting heavy weights and doing all these things. And when you think about PCOS or PCOD is like an androgen disorder, excess
Exactly.
androgen, it's like we're actually we realize now that every medicine that has been studied has been tested on men, right? Nothing's tested on women because their hormones change throughout the month and they can't. Well, why don't we actually treat women like women? And
That's my
you said
point.
women have to be strong. Like, women's strength is in their softness. Women's strength is in that,
Decision and holding the entire universe. Actually, we are already on top, so we don't need to seek equality. We are already above, so there's no need of equality. So anyways, I don't know many people.
That's going to be the name of the episode. We're already on top. We already hold the universe, right?
I don't know how to
Yes.
work that out, but it makes a lot of sense to me. I'm really, I don't know how people will react to this statement of mine, but yes, I'm seeing a lot of girls facing androgenism due to aggression, aggressive behavior, aggressive thought process, dominant lifestyles, like where it is required, you should do, but come back to your feminism. See, I'm also working. So I cannot say that, okay, you should stop working, you should go back to your course and just do household. I'm not saying that, but like the Devis in the mythology. So you remove the sword wherever it is required, put it back, right? When it's not needed, put it back and come back to your feminine essence. Something interesting I'm telling you, I have a churna combination at my clinic, which is called feminine essence. And we have put together all the herbs like shatavari, then ashwagandha, anantamul, manjishta. So all the feminine herbs together. So we give that literally, and that works beautifully for PCOS.
Yeah. Another thing you had said, going back to when it was okay, like when life was normal, then the endocrine and the hormones were normal. And so if women had proper periods at the beginning and up until they left the house. So I don't know if you have this expression in India, but in America, we call it the freshman 15. Have you heard of that?
Not really, but you can explain that
Okay,
to me.
so freshman 15 is when kids go off to college, they gain 15 pounds in the first year because they're eating on a meal plan in the dining hall. Mom's not cooking for them. They're not eating grandma's food at the time. And they're eating processed food. They're eating fast food. They're eating not food, actually.
Well,
And that
empty
we'll
calories.
talk
Empty
about.
calories.
Yeah. Yeah, empty calories, but worse than that, it's like clogging the schrotas. It's just wreaking
Correct.
havoc internally. So of course, the
Insulin
first thing that's
resistance,
going to
all
go,
those things.
yeah,
Correct.
the first thing that's going to go is the last tissue to get the nourishment because there's barely any nourishment going in the system to begin with, and we'll dive into that. Let's dial back to dosha and root patterns to keep
Correct.
us on our flow.
Right.
Can you talk about the doshas?
Yes.
The
So
doshas that are
first,
typically involved?
correct. The doshas that are mostly involved, like there are two patterns to PCOS patients. One is a kaphaja samprapti, kapha pradhan, and the second pattern, which is a very small proportion actually. The major, major chunk you can say of presenting patients will present with the eating, like you said, not eating at all, like just putting something inside. That's also, that is one thing. And a very small proportion, but yes, there is a proportion to it, vata and pitta also. Like in a long period, like I have been seeing these cases since 24 years now. So treating and reversing PCOD, to be very honest with you. Like on this thing, I can say, I can vouch for it that yes, I can reverse your PCOD within say 3 to 6 months for a 9.
I mean, for people that are listening to this, because I know from my own research when I was teaching on women's health, and I had never really heard of that before. It was like these women are suffering for years and years and years, even before they come to childbearing years or in their childbearing years, but wanting to have a child. And just the lack of success that Western medicine offers.
Because see, what they do is they create an environment. Western medicine I'm talking about. They will mask the follicle stimulating hormone receptors so that the body produces more, like the estrogen receptor, so that the body produces follicle stimulating hormone. And that one cycle it works. But then you're not correcting it in the body level, right? You're just adding it as a supplement. And then the next period again, you get dependent on the same tablet. So if you don't take tablets, your body is not ovulating. So instead of that, we have to come to the root cause. Just like I was telling you, there are two sampraptis, kapha pradhan, like because of the excessive sweet, oily, heavy, processed food and sugary food. So you cause a lot of weight gain. Okay. Then there is insulin resistance that happened. So basically here we are seeing four organs. One is the ovary, one are the adrenalins, one is the pituitary and the pancreas. So the samprapti lies between this. So you have to find out what happened first. So is it the insulin resistance that is causing hyperandrogenism, or is it the stress, anxiety, worry pattern that this woman is carrying is causing excess disturbance in the pituitary gland and then causing the, like I said, the aggression, dominance, that pattern. So I have to find out that pattern. So what went wrong? The aggravated vata disturbing the hormonal signaling. Correct. So out of these, I have to choose. So what happened exactly? What must have happened?
So would that be so? Just to dial it back. First of all, samprapti is disease pathogenesis, like how a disease develops. For those of you that are not fluent in Sanskrit, and all of the things that you're talking about in more oily, heavy, sugary food would create more ama toxins in the body, and all of those have the same qualities of kapha dosha. So that would increase the kapha. Now, are you saying also that a kapha dominant person would be more prone to that anyway because they already have more kapha in the system?
Correct.
Is that yeah. And then for the Vata one, would that be more for a Vata dominant person because they're more prone to that stress, over worry, overthinking, all of that?
Correct. So in Vata dominant person, there will be this apana vayu dushti. Like you will see like the girl or the woman will complain about delayed periods rather than amenorrhea. It will be an irregular menstrual cycle, painful menstrual cycle. Like she has to take some painkillers and sometimes it misses. So it's very rarely that she has amenorrhea, but delayed and disturbed and irregular menses. So this pattern is for the vata. So you have to work on the apan vayu here. In the kapha, you get straight away 2 to 3 months of amenorrhea. Sedentary lifestyle, wrong eating habits, insulin resistance. You can see the blood sugar levels are high. So this is, you have to find out the pattern and then break the pattern. That's all. That's the treatment.
Right. And so how would Pitta show up in this? Because
Exactly.
you
Very
said
good
sometimes
question.
Vata Pitta.
So I would like to share one case study. So I have this case posted on my Instagram. That is Dr. Asmita's Vedify Ayurveda. So this is one lady who was suffering from 9 years from PCOD, diagnosed like bilateral polycystic ovaries with hypermenorrhagia. So when she used to get the periods, it wouldn't stop unless she was admitted and she was given some medication for stopping those periods. So for 9 long years, this female was getting admitted every menstrual cycle, and she was very tired. And finally, somebody told her,
She
"My
must
name
have been totally anemic.
anemic." She was very anemic, and she
Yeah.
was also having palpitations, panic attacks, and her pulse was 120, like constant 120 beats per minute. Okay, so she was in that condition, extremely stressed and extremely like anxious about everything. So then this was the pitta. Only one case I can say that was completely pitta. So I spoke to her like how it began. So until her marriage, everything was normal. She did not have PCOD at all. After marriage, after 2 3 years, her cycles started getting disturbed. And then I spoke more about what happened after marriage. So then she started crying. So I said, "What happened?" And she told me that she was forced into marriage that she was not liking. I mean, she did not want to do. And that anger she carried inside her. And the pitta gun, that the drava gun increased. Okay. So that disturbed the cycles also. There was like, of course, the samprapti or the pathogenesis of PCOS was there. But along with that, there was a high pitta, which was causing the excessive menorrhagia that no allopathy or modern doctor would understand. And then speaking to her in depth, reassuring her. I said, do you want to get out of this marriage or you want to continue? So she said, I want to continue. And it was like her sister died in a car accident and she was married off to the sister's husband without her permission, just because they had small kids, and it was a forced marriage by the parents. So it was a major trauma in her life. Then I said, how is your husband? Does he keep you well? So she said, I love my husband. He's a very nice guy. So I said, now don't hold that grudges for your parents. What happened to you is extremely saddening, disheartening. I went to her and I literally on the floor, I said that I'm saying sorry on respect of your parents, and everything that happened to you was so, so, so sad. But now if you have kids and you have a good husband, do you want to continue this marriage? So she said yes. And after that, her perspective changed towards her marriage. So she has said that on camera. You can listen to that video, but it's in Marathi, of course. You can do the translation thing. But after that, her anxiety levels dropped. We did Shirodhara, we did other things. Like actually, I gave all Pitta Shamak medicines to her. And in this case, I had to work only on Pitta exclusively, and her periods became much regular. Everything fall into place slowly and gradually within 3-4 months.
Save 15% on Ayurvedic products like oils, herbs, cleansing supplies, and more from Banyan Botanicals. Use the code 15KARI. That's 15 KARI. The link is in our show notes.
My heart is both heavy and light at the same time hearing that story.
Yeah.
And listeners, this is exactly why I asked Dr. Asmita to be on the podcast, because those stories that she just can pull out all these years later of these lives that she's changing, because she's dealing with the whole person. And Ayurveda is a system of complete medicine.
Correct.
And offers hope where you may have been dealing with frustration or feeling not heard or feeling like you are going crazy because you should just be fine. You should just be fine. For any of you listening, we will absolutely link all her information in the show notes. And this is why I'm devotee of Ayurveda. So thank you. I have my list of questions and we've touched on most of them, but talking about the tissues, the dhatus is the word. So you had talked about the organs that are most affected in PCOS. So can you just talk a little bit about the tissues that are affected and specifically what's happening at the level of Meda dhatu in many cases?
Definitely, definitely. So the first dhatu, that is the rasa dhatu. So that is formed out of, again, whatever we eat, there's a chine to it. And then, to be very precise, in Ayurveda, the 1/8 part of that chine goes in the preparation of the rasa dhatu. And out of the rasa dhatu, like the first tissue that is formed, Raja and Stanya are the upadhatus or the sub tissues, we can say. Raja is the menstrual blood or menstruation. And Stanya is the breast or that system, lactating system entirely. So these all are connected. And the rasa dhatu, if it's affected, it gets affected by stress. In Ayurveda, it says that rasa vahini dushyanti chinta namati chintanat, means when you do excessive worry, stress, and anxiety, your rasa dhatu gets affected. And this is the main tissue that is going to affect the PCOS or the normal formation of ovum. Okay, so that one, then followed by that rakta dhatu, rakta dushti, because it's the artava srotas, and artav means rakta or blood. Okay, so rasa, you can say the entire plasma in the body or lymph, and rakta is the blood. The third one, where the cysts are formed. So you can consider involvement of the mausa dhatu. Okay, so rasa, rakta, mausa, and lastly meda. So meda can be there in both ways, like it is lean meda and aggravated meda. Okay, medas is the fat tissue. So you know what happens in PCOS, like we accumulate a lot of sugar and high sugar levels, and that goes into the liver and it's converted into glycogen. It's stored in the fat cells. All those things we all know as the modern view. So in Ayurveda, what we say that there is mandagni. It's because of kapha pradhan ahar, you cause mandagni at cellular level, not only at the gastric level, but at the cellular level. The cells are so poor or so depleted in Agni, they don't want anything new. So that is insulin resistance in Ayurveda. The mandagni concept or the ama concept, that is where the insulin resistance concept comes. So if you start exercising, if you leave your sedentary lifestyle, if your muscle are craving for sugar, then only the sugar that is circulating in the blood will start getting used up, right? So again, it comes to correcting the Agni. So first thing that we would want to do for this is Rasa, Rakta, Mausa and Meda. These four tissues, we'll have to see how much or how many of them are affected in Ayurveda.
She just answered the next 8 questions in one.
Did I? Did I? I'm
I'm
so
like,
sorry.
okay, we've answered that. Okay, so just to recap, Manda Agni is when your digestion slows because of
Correct.
high toxic load, right? And if you remember from if you've done workshops with Larissa and I, or if you've listened to any podcasts with Larissa and I, or done our cleanses, the inverse relationship between Agni and Ama, right? So when your Agni, when your digestion is strong and high, the Ama and when you have a higher Ama, more toxic, more metabolic waste, that makes the digestive fire slow. Imagine trying to cook something on like a level 1 flame. And so it just kind of sits there. And so
You
that
can't
manda,
increase the flavor. Correct.
yeah, and then it like petrifies and putrefies and creates more ama, right? So
Correct.
that you really you can't have a conversation about PCOS or insulin resistance or any of that cyst formation without understanding the role of ama and agni in it. And in talking about the pathogenesis of dis-ease in the body, always in Ayurveda comes down to your digestion. Because that's
Even
where the tissues get fed, right?
so
Go ahead.
even the modern science says that it's an endocrine disorder and a metabolic disorder. So they also know, they establish the role of metabolic disturbance in PCOS, right? So that is our Agni concept.
Yes, it took them a minute, but they've come around.
Right.
Now they understand what you eat matters.
Exactly. Exactly.
Okay, so we talked about insulin resistance through the Ayurvedic lens as well, and just moving and eating real food, and then dealing with, the sugar in the bloodstream, but also what's stored. So reducing the meta dhatu, the fat tissue. Let's talk about lifestyle, nervous system, and daily rhythms, because Ayurveda is very big on daily rhythms, practices.
Mhm.
Dinacharya would be the word even, okay? And so
Yes.
what are some of biggest contributors or common lifestyle contributors that you see that would be sedentary
Correct. Poor eating
and
habits,
stress?
sedentary lifestyle, poor sleep pattern. Like we consider sleep as a luxury and not as a basic life support. You have to sleep at a certain time. You have to wake up, like disciplined lifestyles. And your body is completely working on a feedback mechanism. So you keep confusing your senses, you keep confusing your hormones by this anytime waking up, anytime sleeping, anytime you're munching. So regular meal timings. Okay. So there is no good answer. Like I don't have any quick fix solution to PCOS problem. You have to literally work on a person's lifestyle and diet. So I ask them to eat right in a moderation, and maybe healthy diet, but at wrong timings won't help. You have to put a discipline on your food eating meal timings, basically, right? So everything has to fall in place. You have to be in your perfect weight, neither extra nor less than the BMI. So that itself helps you ovulate. So you don't need much medicines. For young girls, I don't give medicines. Sometimes I just write down the diet and lifestyle. Literally, I understand what is their necessity, like what is their working pattern, what time they go to college, what time they come. So just creating a form where I have some diet recommendations and a lifestyle change, which is not something that is impossible to perform, which is little, I create it for them. So there are some little things here and there, but then try to bring it to a centrum, like try to coordinate with them, and we both prepare. Okay, this can you do? Can you do dancing instead of exercising? Okay, go for dancing. Do you like aerobics? Do aerobics. Do you like hiking? Go this, do this. So creating some possibilities in their lifestyle where their sedentary lifestyle is cut, plus bringing back a rhythm to the metabolism and life. That is actually the secret to treating PCOS. Actually, a very few cases where it is very old or like the tunica, the membrane of the ovary has become very thickened. There we need to do Uttar Basti. That is again an amazing treatment modality in Ayurveda that literally goes and acts inside the uterus. We inject certain medicated herbal oils inside the uterus through a treatment called Uttar Basti. So Uttar Basti is a lifesaver. And I have seen so many cases before Uttar Basti, they had this many inflamed ovary and so many cysts in that. After Uttar Basti, after 2 to 3 months, immediately they start ovulating normally. And at least 3 to 6 years, there is no return of these symptoms.
Wow. And so when would you, so Utarbasti, it's like a vaginal
Mhm.
enema, so to speak. And so
Correct.
how many treatments would that be?
It is 3 months consecutive treatment on the 6th, 7th, and the 8th day of your menstrual cycle. So, counting for the first day when you had your period, so 6th, 7th, and 8th day, they have to come here. And I inject almost 1.5 ml to 2 ml of medicated grutam or oil, whatever according to the cause. You have to find out. We prepare that. And first, it is like you kind of remove lekhan chikitsa is done with some herbs like kachanar. You know kachanar well, you must be remembering. So that is a drug of choice in PCOD. Okay. So there are certain oils which we create, siddha tailam, that we, what you can say, prepare for PCOS. And then second month and third month. So 3 months consecutive Uttar Bastis are given.
And what if they're not ovulating every month?
So that is what. In very bad cases, I'm saying this is the last resort. Like if you have done diet modification, lifestyle modification, medicine, internal treatment, also panchakarma like Vaman, Virechan, Basti. So all that doesn't work. The last resort is Uttar Basti. Even if they are not ovulating, we have already given them certain herbs in the internal treatment, which will start make them ovulate. Okay.
Wow. And you touched on sleep. And as you were saying that, I was just worrying about my daughter, who's a junior in college.
Okay.
Doesn't sleep. They're up all night. They're partying. And I just, just
I know how
hoping
it
she
pains.
gets
I
through it.
also have a
Hoping
daughter.
she gets through it all without getting any disease. Um, yeah, eating breakfast at 2,
She has her mom's
dinner at
healing
1.
vibes. Your healing vibes are keeping her well. Same here. I also have
Yes.
a daughter. And they do have erratic lifestyles. She's into design, so she has to stay awake all night. And at a stretch, they have to work for 10, 12 hours. So, yes, this is the reason why these things are on a upsurge.
Yeah. But managing vata and managing stress, routine.
Mm.
Living in harmony with the circadian rhythm. We talk about that all the time in our yoga classes and on the podcast, and really getting enough sleep for your constitution. And that is one of the pillars of health. So it's so important to again look at the whole picture and to really food is medicine, sleep is medicine, and all of those things. Let's talk about yoga. Again, that's near and dear to my heart. And I know that you also prescribe yogasana and routines in people dealing with different lifestyle diseases as well. We talked about, movement influences doshic imbalance, obviously, because we're talking about PCOS, kapha vitiation, and excess of kapha dosha. And so movement is going to be the best thing to do that. What
Correct.
kind of yoga or movement, like you said, dance if you love it, hiking, just move and do something. But what yoga
Just move.
asanas would you prescribe for someone who's thinking Surya
So before I
Namaskar?
answer that, let me say that I picked up this topic of PCOS. Why? Because I know I am saying this very honestly. Like even than Ayurveda medicines or modern medicines, the one thing that I have come across through all this practice is that yoga yoga works amazing, like miraculous wonders for all your listeners that are listening, for everywhere where it is a endocrine disorder, where hormonal signaling, where energies, where vata disturbances is there. So yoga is much, much, much better than any other form of exercise. So I prescribe yoga alongside medicine, and that would be um, yoga patterns that bring the hypothalamus pituitary ovarian axis in place. Like it is fallen apart, so you have to bring it to place. So cobra pose works well with that. Butterfly pose can work very nice. Then sun salutations, if you do it properly, there are 13 asanas inbuilt in a single sun salutation. So if you do a sun salutation slow yoga, holding each and every pose for say minimum three. I shouldn't advise this. You will be a better person. But at my level, whatever I feel, I advise sun salutations for increasing pelvic blood flow. So any yogasana that would help us stimulate and improve pelvic blood flow, like Marjarasana or butterfly pose, moving butterfly, all those things, and sun salutations. That three I know you can guide better than me.
And so would you prescribe, so on that, would you prescribe the sun salutations differently for kapha presentation, like a more rigorous sun salutation at like 6
Correct.
a.m. or 7 a.m. versus vata dominant?
Yes.
Would you prescribe it just like a slow sun
Correct.
salutation or gentle, slow flow, or restorative, like a Supta Baddha Konasana for vata
Correct.
dominant, or to help restore upon vayu?
So rigorous and fast sun salutations for, and even the number is more for kapha, and the number changes for vata, and it goes into slow, holding breath, and focusing more on groundedness, all those things. So the whatever I will administer, it will be definitely different for what pattern I have cracked. So if is it kapha dominant PCOS or is it vata dominant? And very rarely I get some pitta cases as well, but that's very rare to happen.
What about mudras or mantras? Do you prescribe any of those?
I don't have much knowledge on that, but Apan Vayu Mudra is something that I have myself known that it works very well. I'm a Vata person, so I had followed this mudra thing. Yes, so that, but people, I mean, it's very difficult. It's a complete new science for me to learn. I'm not very good at those things, I suppose.
So I guess you don't really have a first line of fire in terms of dealing with PCOS, because you're going to deal with the Agni
So
and
many
the
times.
Ama at the same time, and then reducing Kapha dosha or Vata dosha.
What I can do is I have tried to classify the symptoms into kapha, dominance, vata, and ama. Okay, so if a person or if a lady is coming with symptoms like obesity, uncontrolled weight gain, thyroid, okay, diagnosed thyroid, cyst formation, sluggish metabolism, and insulin resistance. That pattern goes more to kapha dominant PCOS. Okay. The vata dominant PCOS symptoms would be like, as I said, irregular menstrual cycles. Like if you ask in detail, the flow is like sometimes it's normal, sometimes it's comes blocks, disturbed flow. Then even the pattern like blackish, stale colored, means maroon, brown, dark colored discharge, clotty, diagnosis of a bilateral polycystic. See, like 20 cases if PCOD are coming to a modern doctor and 20 cases are coming to me, for me each case is different. So I'll have to, there is no same medicine in Ayurveda for all. So I'll have to definitely find out what are the patterns. So at least these we can. And for AMA, it will be like the AMA kind of blocking the Artavasruta. So complete amenorrhea. Okay. So
So
clogging
no
of that.
period at all. No, yeah.
Plus, in the AMA pattern, I will get a person or a lady saying that she does not feel like eating. She does not have the bowels properly. It's a sticky bowel and mandagni, severe mandagni. So those things will be there associated with this PCOD.
Yeah. Any other stories that you want to share in terms
Yes.
of a case scenario that you had real success in, or
I will share a case where I'm not having success. There is this girl who has been on hormonal support for past 4 years. She came to me, and because she was like, it's a very bad case basically. So she's completely having medicine dependency. Okay, so I did panchakarma for her. When I did the case study, I came to know that she has very, very, very poor eating habits. She is a Vata person and a Vata dominant PCOS case where I can see signs of hirsutism are there. She's lean, but having a complete sedentary lifestyle. She does not do any work. She's not going to college. She's taken a sabbatical or something, and she just keeps on munching all day long. And she has a severe krubi, that is an additional thing to her. But then there are, even when I check the abdomen, there is hairline. Just one sec. Okay, so this, even I am not able to like crack this case. So we did medicine treatment for her, and I gave her medicines about 6 to 8 months of treatment. And because she was unmarried, I could not do Uttar Basti for her. But still, I did Panchakarma, I did Basti Chikitsa. Yes, and I would want to add that she has a severe history of constipation since childhood. So severe means I tried very, very strong medicines, but then that didn't work. Then I switched to castor oil, and now she's on castor oil. So we are trying to bring all her vata in balance. After 8 months, I got success, and literally, so I was tired of not getting success in this case. So finally, she started ovulating normally. She started having periods every month, and this went for a year or so. And then again, she came to me. So recently, she has come to me. Then she said, again, I'm not exercising. Again, I'm munching. Again, she did not know so many food items. Like I was asking, and she said, yes, I eat that. I said, this is increasing your vata. So all wrong again, she did to her body. No, again, we are working on it. So very stubborn case.
Yeah. And, it just shows again, it's so hard for people to
Mm.
change, even when they know
Actually,
what to do,
actually,
right? Which goes back to that Prajna Pride, like crime against wisdom is the root cause of disease. Right? It's like
correct.
when we know better, we do better, but not always. Not always.
So again, I'm very sad. But then on a positive note, Kari, I would like to add that there are very, very huge number of cases. If you want, I can provide the details of it. I have so many cases where it was only 3 months of medicine, and now they are having a very good ovulation. Sometimes the reasons are temporary. So it's just a change in state, a change in food habit, or some sleep cycle is disturbed, and you correct that. You correct their weight, you correct the ovulation pattern, and it's done. Okay, so most of the times, like 90% of the cases do not have relapse. So it's very promising that Ayurveda does treat PCOS from the root
Yeah.
cause.
Absolutely. And lasting, right? Because people don't even realize that this seemingly benign thing is what's at the root cause. Like going to bed at 4 a.m. or eating this stuff. It's like that's the root cause. You change one thing, you change everything, right?
Right.
And
Right.
so in regards to that, in closing, what is one small shift a woman with PCOS could begin today that could really help to move the needle for her?
Nice question. So, start avoiding sugar and processed food and heavy. Definitely start moving, I would say. Even if it's a vata, then the moving can be like one more thing I want to add here. Even in the vata predominant cases, if you see the body fat versus body viscera, their fat percentage is more. So the vata channels are clogged due to maybe ama or maybe some other cause, not necessarily kapha every time. It could be ama also. But again, for that also, moving, eating right, again, coming back to those patterns. So one thing is stop eating sugar in excess. Let the sugar be used.
Amen to that. If you could shift one belief that women hold about PCOS, what would it be?
It gets treated with only medicine.
Yeah. Yeah. Because what you do matters.
You have to
Right.
change completely. Otherwise, it's not possible for us to treat you.
I love that. Dr. Asmita, thank you so much for joining us today. One question I wanted to ask you, just in closing, what does your daily practice look like? Yes. Yeah. I love it. Thank you so much. I will link your socials and your website. What's your website? VedifyAyurveda.com. Dr. Asmita, it's been so nice to see you. I haven't seen you since I was in India. Thank you so much.